Welcome to Lasting Lifestyles, a support program for caregivers and families. Hello, I'm Janet Corbally, Director of Vibridge Connections, and I'm pleased to have joining me Dr. Ina Yaskin, who is a geriatrician and internist. Welcome, Dr. Yaskin. Thank you for joining us. Embracing palliative care. I'm sure you're embracing it every day when you're dealing with your patients and dealing with families. What exactly would be involved? Palliative care is easing the psychological and spiritual issues and supporting families. And it's a team effort when it comes to providing palliative care services. Could you provide to us an understanding of what exactly is a palliative care team?
Palliative care team usually includes an attending physician who is a physician for that patient, nursing, whether it's LPNs or RNs. Volunteers are included a lot of times in the hospice team, not in every palliative care team. Then an attending physician who has expertise in palliative care services, whether it's a geriatrician or board-certified physician in palliative care and hospice services.
So, when you talk about that team also involved the caregivers as well, and the families.
That's right. I'm talking about the professional team members that are included to serve the patient and the caregivers.
And they're all trained as well.
And they have appropriate training in palliative care services. There are actually nursing courses for palliative care services. So usually it includes a nurse who has this training. It also includes a chaplain and a social worker to help coordinate all the necessary discharge planning and care over plan.
So it's pretty comprehensive, the team that's put into place to really
Definitely.
meet the needs of the family and be supportive of the patient as well. And understanding the involvement when we're talking about supporting caregivers and families, what kind of feedback have you gotten from caregivers? What do caregivers really want from a palliative care team to really help guide them through these times?
What I found the caregivers and the patients want is access, 24 hours, 7 days a week access, which palliative care teams usually provide, whether it's the nurse who answers the phone and gives the messages to the physician to follow up with their care. They also want honest information, and they want time to be spent with their loved ones and with the family themselves. They want empathy, which the palliative care team provides and has expertise in.
And I'm sure, as you're well aware, when you're working with caregivers and families, some of that can get lost because they're confronted with so many decisions and just emotionally dealing with someone dying, and knowing that as part of that team effort, it's the whole family that is being addressed emotionally, spiritually, to assist them through this process, and that they are not alone. And I can see so emphatically the value to the caregivers and how important it is to them. What kind of feedback have you gotten from patients who are in need of these palliative care services?
Patients usually want relief of their pain or other symptoms. That's their probably number one concern. They also would like to be involved with the family members at the end of their life process. They want them to be included in the decision process. They want their wishes to be respected, and that's what palliative care team usually does. It meets on a regular basis with the patient and the family, addressing all these issues with special concentration on pain control and symptom management, as well as the advanced care planning.
So there's continued communication. It's almost like hand-holding, that kind of emotional, compassionate support that's provided to family and patient, which is beautiful in the way it should be when we think about quality of life and end-of-life issues. As a physician, what are your thoughts within the medical community seeing the suffering and cure of disease as a dual obligation within the medical community? What are some of your thoughts on that?
What I see that the Western medicine used to two concepts, either cure the disease process or provide comfort care. What palliative care services are trying to accomplish are really to combine the two, which is, I think, is critical for patients with chronic illnesses that will live with those illnesses for months and years, and would like to include curative measures as well as to have the concentration on symptom control management.
That really brings to mind when you talk about people dealing with chronic conditions, and you don't know how long that may be. There is no time frame that you start and it's going to end at this time. So holistically, what are your thoughts on the benefits to palliative care services when we're thinking that we're seeking these kinds of services and supports, and it may be a few years out before someone passes or may not? The benefits are comprehensive to a family and to the patient actually seeking the services.
Some diseases have a more predictable course, such as oncological diseases, cancers. Some have more like a rocky type of course of illness, such as congestive heart failure exacerbation, where I see frequent rehospitalizations. And what palliative care services are trying to provide is basically keeping the patients at home and achieving that symptom management at home, preventing them from having unnecessary procedures and unnecessary treatments.
Well, there's nothing like home and being around your precious memories and the people that you love, which then brings to mind, if we're talking about a timing of a particular condition or illness, how and when should someone begin to plan for palliative care services?
Palliative care services can be introduced at any time of the illness. It can be introduced with an acute illness. It can be introduced in the hospital stay or after the patients are discharged. There's really not no specific time when the palliative care services can be introduced. There's really an option of when patients can be asked to get involved with palliative care services.
Dr. Yaskin, just knowing that this kind of support exists in the community and from our professional community most especially, I thank you so much for sharing this information.
You're welcome.